Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of the Kidney Disease Solution, Kidney Mastery Program, Kaigenesis, and Kidney Coach. And I'm joined again today by one of my favorite guests to have is Jessianna Saville. Jessianna is the CEO, the founding dietitian, renal dietitian of Kidney Nutritional Institute. So she has a great big organization over in the US there that works specifically with people diagnosed with kidney disease and looking at dietary interventions as well as nutritional interventions and how to help people better live healthy, full lives when they've been diagnosed with kidney disease. Jess, thank you again for being here. Always love chatting to you and sharing your knowledge. How are you?
Yes, I'm doing great, and thanks for letting me be here tonight. I love to pick your brain, which is what I was just doing a minute ago.
We were just both having a brain pick there. We're having a brainstorm about a patient, which we love doing things like that. So anyone out there that does see Jess or I, just know that we often talk about you before we hit record so we can actually get into the crux of what's happening with people to better help support you. So we were just doing that then. And actually it was related to what we're going to talk about today, which is renal-induced lithium toxicity. Renal-induced? No, lithium-induced renal toxicity.
There you go. And who knows, could be chicken or the egg sometimes. But yeah, usually that, lithium, which is commonly used for psychosis, can definitely cause kidney problems for some people. And we see
Yeah, for
that.
sure. It's quite a what was it? 95% of lithium is detox through the kidneys or something like that, wasn't it? That we just were looking at in studies.
Nine
So
kidneys are responsible for 95% of lithium excretion. And that's a big job because if it builds up, well, one, you can cause damage that way, and other, and if it builds up and you don't have a lot of kidney function, you're also not going to be able to excrete it well.
exactly. So well, let's dig into it. So first off, let's talk about quickly what lithium is. Anyone that's been diagnosed with bipolar has probably heard about it before, but talk me through the drug. Because lithium, people think, oh, isn't lithium just a mineral? Like that sounds pretty safe. So walk me through the drug and what it's used for.
Yeah, so there are a class of, I don't know if you call them nutrients, right? Heavy metals. We think about lead commonly, and people think, whoa, like lead in your paint, that's super damaging. It is damaging, but there are multiple other heavy metals, and in really tiny doses, they have some use in our
Hmm.
body and can be very helpful. But in larger doses or in the wrong form, because most minerals and they don't just stand alone. You don't just have lead, just like you don't, water is H2O, right? There's a couple components to it. So most minerals are comboed with something in in different forms. They can be damaging to some people. So yeah, so lithium is a heavy metal which has a couple different forms. One of the forms that is used for bipolar disease. It's a very common treatment. I think it's been around since like early 1900s. I can't remember. It's been around a long, long time. Choose lithium can be really, really incredibly helpful for a lot of people. But one of the side effects is that it can cause some kidney damage.
Yeah. And, we were talking about this when we caught up last time, actually, and I was surprised by how many people you have coming through the clinic at that time with renal damage caused by lithium medications. Is that something that you are commonly seeing?
Yeah, and it's hard to say if it's the only factor or if it's one of many factors, or like is it it created some fragility, and then on top of other lifestyle factors, that's where there's a lot of problem. But definitely, we've had multiple patients where lithium is a big part of their story, and they seem really otherwise quite healthy, except for they've had this in their in their history or were taking it recently. When you look at the diagnosis, the doctors will often link it back to lithium as well.
Yeah, okay. Fascinating. So, what is it about the medication lithium that causes damage to the kidneys? What mode of action or why is that such a common side effect?
Ooh, that is a good question. I have notes on it here
I wanted to
because
share that story because that had all the toxic pathways in there too, didn't it? That
Yeah, I
there's some.
was just going back up to it. Some of it is some things they don't know. Sorry, let me just pull down here on it. Um, I don't know what the exact pathway is on how it causes damage. I just what I know is that because so much of it is excreted through the kidneys, um, that's where it tends to be a obviously the biggest problem, right? You don't hear about lithium-induced liver toxicity, but
No.
but lithium can accumulate in the liver, it can accumulate in the bone, it can accumulate in the muscle, it can accumulate in the thyroid, in the brain, and then the kidneys also, right? Like you'll see lithium in all these tissues where it deposits. I don't
Yeah.
know what the pathway is where it causes damage though. Um,
All I can see is it looks like it causes tubular necrosis and tubular lumen obstruction.
yeah. So yeah, and I don't know exactly. I might think too hard to like went down to the nitty gritty, and I don't know.
Yeah, and
Um,
they may not know, but yeah, that's what the studies I'm looking at the moment, where when we'll talk about other things that help with it. But yeah, they're saying that that's what they look at when they're doing all these studies, is the percentage of tubular necrosis and tubular lumen obstruction. So it must, and I wonder whether it's that whole thing we were talking about with sodium, whether it's just you know drawing stuff in through the lumen, so you get like um dehydration or damage to that tissue at that exact area if the salt's binding up that area. That's what I'm thinking, because lithium's a salt, right? So it's a heavy metal in a salt form. And
yes.
I'm wondering, because and you'd said to me before that it, and I'll get you to talk to this because you understand it more, but how lithium and sodium, like the kidneys treat lithium just like sodium. So I'm thinking, okay, there might be like, if it's pulling it through and it's a damaging molecule as it comes through, it's causing like that scar tissue fibrotic sort of, it's just it's not more complicated than that, and then that causes the
That
fibrosis.
that would make sense. Yeah, you're exactly right, right? The kidneys, they treat lithium and sodium the same, and all of us know that kidneys are a huge part of balancing sodium in our body, like the
Mm,
sodium fluid, the different electrolytes. But the kidneys treat it the same. And so when you have a sodium depletion, it actually can increase your lithium reabsorption, which means you're gonna have more of it like coming through and then coming through again. And
yeah,
that is fair. I would say that sodium depletion could be pretty common in chronic kidney disease, especially if people have already been diagnosed. I mean, there's lots of reasons for getting sodium depletion, from dehydration to being on a diuretic, but also we have a lot of people that eat like no salt. They have like zero salt in their diet, and then they do like a large volume of fluid, and that sodium depletion could definitely exacerbate or make the lithium worse. So,
that makes absolute sense. So I think I've got my head around how it causes damage and that as well, and it will be via that mechanism. It's so fascinating. So and then there's a very specific thing that can happen in lithium-induced toxicity, which it looks like, what do they call it? It looks like diabetes, right? It's
type
lithium-induced nephrogenic diabetes insipidus, right? That's the most common side effect we see in lithium. So walk me through, and they're saying in 50 to 73% of patients using lithium long-term will end up getting this.
wow. Yeah, I don't know. Like the pathway on this, I don't know, but I mean, definitely for anyone who's on lithium, right? It's not that you come off of it right away. It is that you understand where the risks are and you have monitoring and you have some strategies, which we'll talk about in a second, to reduce the potential for toxicity. Because if it's going to cause kidney damage, nephrogenic diabetes insipidus, like those are going to be problems, right? Big
Mm,
problem later on in in your life. And the thing is that sometimes when you create scar tissue in the kidneys, right, or in the pancreas, sometimes that scar tissue can get turned around, but not always. And that's where you get kind of that permanent damage. So being proactive early on is really like the name of the game with that lithium. And being able to really dig deeper if you're using it for bipolar, sometimes it's just like I said, it's very, very effective treatment. It's really, really important. But even with like mental health, there are underlying causes, other nutrient deficiencies, and we like treat with antipsychotic meds and we haven't addressed the underlying cause. So
For
kind of
sure. I think that's a really pertinent point
another
to.
topic though, another topic is mental health and that sort of thing. But on lithium, right? Knowing what you can do to prevent the toxicity, I think is really key.
Yeah. And it's interesting. I'm just looking at motor mechanism here. So they're saying that what happens long term, this goes back to this whole sodium thing, I think, is that in
Mhm.
induced nephrogenic diabetes insipidus, what happens is the kidneys can no longer concentrate the urine. So then people get excessive thirst. So then you're drinking more, you're diluting more. Then what happens? You get vasopressin and antidiuretic hormone that regulate the balance of fluid intake go completely out of whack. So you get ADH levels are decreased, and then the kidneys start to produce more urine. So you're just getting these kidneys completely working overtime. So lithium interferes with ADH signaling pathways in the kidneys, and that interferes with the normal function of the collecting ducts within the kidneys, which are critical for water absorption. So lithium enters the cells at the collecting duct through the epithelium sodium channel, which we were mentioning before. And that is where, because it's not sodium and because the kidneys are thinking it is, it has this complete inhibition on ADH. And then glycogen synthesis kinase 3 activity and CCAMP, which we know CCAMP right in polycystic kidney disease. That's one of the mechanisms of CCAMP causes dilation in the tubules. And then you
Mhm.
get that dilation all the time. And then if you're eating lots of oxalates, then the stones, they dilate to let the stones through, but then you get this permanently dilated kidney nephron, which then stretches it all and it gets a whole pile of damage to it. So I think it must be that pathway that it's going about. But it's, it is reversible early in treatment, but as you said, it can become irreversible over time, the more stretch and damage and fibrosis processes that starts happening to that kidney tissue.
Absolutely. Yeah. Yeah. I mean, that is a brilliant description. That's why I love to come work with you and talk with you because, like, that's right, right? Like, if it is replacing with sodium, that would make sense that
Mm.
it's, damaging
Totally
those
makes sense. So what
tubules.
blood tests are you doing? So if you have someone coming in and they're on, I mean, they're obviously, if they're coming to you, they're like, well, we've got kidney damage because they've been on lithium. But what would you, if you had a patient that you were looking for that and they were on lithium and you didn't know, are there certain blood tests and things that you would be checking?
Yeah, so if you're looking, so always when we have a patient come in to Kidney Nutrition Institute, the number one question, if you come to any of our classes, we talk about this. The number one question I want to ask is what caused your kidney damage, because that's going to inform how you plan your treatment. So if I see that lithium is either in their current medication list or in their history, that is one like huge piece that I'm going to start narrowing in on. Now,
Mm,
uh, regular conventional testing usually won't identify a deficiency very easily unless it's a really big deficiency. You usually have to do some sort of functional testing where a blood and a urine test where they're looking a little bit on some more specific markers. So we use one called NutriVal at Kidney
mm.
Nutrition Institute, and it's a blood and urine test, and it can kind of give us some markers on not just lithium but other heavy metals. And usually I find that things like it's usually not so linear, like it's not just a lithium deficiency. There can be other things going on as well. But we would look at, I'd want to know if there's a deficiency, but even before that, right? Sometimes you don't have to test because you already know, right? You already know that's going to be a problem. In that case, if I'm like, ooh, like we have to do dietary foundations first, right? Foundations are like make sure you got your alkalinity and your protein right and your fluid about. So there's like some dietary foundations we just do first. You have to have them in place first.
Yeah.
Then what I would be looking at with lithium is I was like, can we even get this out of your body, right? Do you have a good bowel movement? Because even though 95% goes to your kidneys, there is still other pathways to get rid of lithium, and that is through your gut, right? Your feces and your sweat. So I would want
Mm.
to know, right? If you're super constipated and your gut is not working, it's going to be a lot more difficult for us to be uh, helping start moving some of that lithium out of where it may be accumulated. So we usually work in the gut
Yeah.
first make sure the gut's super good, we got plenty of fiber, um, and then we would move on to lithium next.
Makes sense. So, what are you using to detox lithium from the system? What are the things that I know what we use, but what are the things that are your go-to when you're working with lithium induced nephrotoxic damage?
So, I mean, for lithium again, right? Gut, fiber, like I need to make sure that those are set. And then from there, I want to make sure that the liver is going to be working, right? And there's some things like, do you have enough sulfur vegetables? And I'm just thinking dietary
Yeah,
right
yeah,
now. Do you have enough sulfur vegetables on board? Are you drinking plenty of fluid, right? These would be foundational pieces. And then when you start pushing the lithium, the one that you see in the research, which you also identified as well, is using NAC,
mhm,
um, N-acetylcysteine. That tends to have a really direct uh, connection with a lithium toxicity. The one thing though that people have to realize that's super important is that you want to like clean it all up, right? It's like if you've dusted in your house, you want to like sweep it all up at once. When you are removing a heavy metal that has caused damage and that goes so heavily through the kidneys, you have to go slow. So you got to be in it for the long game for a few months, right? Because you're going
for
to
sure.
start really slow, super low dose. Again, like is your gut working? Are you sweating? Are you drinking a lot of water? Do you have like other nutrients on board?
Enough
And then
sodium, that's going to be
do
massively
you have
important,
enough
right?
sodium, right? Are you on a super low sodium diet? Can we bump the sodium up a little bit? Do you have enough magnesium? Do you have like you gotta have your minerals on board as well? Um, but if the foundations are solid, then you can use the NAC slowly and
Mhm.
really slowly if your function is lower, slowly and like slowly bump up the dose. Um, Most of the time when you're working with any heavy metal, you also would add some sort of a binder initially, like charcoal or zeolite clay to help kind of bind up whatever starts coming out of the liver, bone, muscle into the bloodstream. And so you might add on a binder as well. So
Yeah.
especially in that kind of that first phase.
Yeah, no, totally agree. Yeah. Some bentonite clay or zeolite. I like the zeolite fulmic humic acid kind of blend for that sort of stuff. So,
Yeah.
and I didn't know this until talking to you just before that, yeah, you'd have to absolutely make sure their sodium is on par because otherwise they're just going to reabsorb that lithium round again and cause even more damage potentially. So,
Yeah, yeah, absolutely. And this this is not so much founded in research, but I tend to add it in with almost anybody who I'm assuming has some sort of a heavy metal problem. But I will add in some sort of like chlorella or spirulina or cilantro, and they bind up with the different metals. But I feel like the amount of nutrients we get with them, and if we're picking up anything extra, that's a bonus. It's so easy to add those in, right? The chlorella, spirulina,
yeah,
cilantro into like the regular therapy, whether it's in like a smoothie or a greens drink or something that
yeah,
people can put in their
yeah,
regimen. But
yeah, no.
there's not a good study on like chlorella and lithium, but I
No,
think
lots with mercury, and but even Corella, you've got to be really careful because mercury is Corella's a mobilizer. I've seen this in MS patients where they've gone to see a practitioner. They go, oh, it's mercury. They've given them high dose Corella, and all it's done is mobilize the Corella from, say, the brain, and they've become mercury. I've had a patient, wasn't I
mm,
hadn't, but they came to see me in the aftermath. Got rushed to hospital with mercury toxicity because the practitioner mobilized it using Corella,
chlorella.
no with no
Interesting.
binding things, yeah.
Yeah,
So you have to be
binder.
really careful when you're mobilizing heavy metals.
Yeah, absolutely. Yeah. And I think that really is the story, right? Like if you have some of this in your history, you can get it out, right? There are tools there, there are ways that you can approach it. But if you are assuming that lithium might be part of your story with kidney disease, I really think it's great to at least have like one session with a clinician who's familiar with it and
Sure.
build out a protocol for it so that and you don't get in a hurry, right? I should already feel better. I should already see my kidney function go up. It's like a slow game, right? It's a
Mhm.
slow game to slowly work on things.
Yeah.
So
And I think it's a big thing, you like say you don't want to reabsorb it and make it worse and cause further toxicity. So I think when
Yeah,
you deal with heavy metals, you should always work with a practitioner.
yeah,
It's easy to say take N-acetylcysteine and some binders, but you have to make sure that sodium's on par, the gut's working, everything else that we said. How do you titrate down your medication? And I'd also say in the study that I was looking at is that anyone that is on lithium long term should be paired, a bit like you were saying, before, like if you're on statins, you should take coenzyme Q10. We know it depletes it.
yeah,
Like, if you're on lithium medication, if you go right from the beginning and pair it with NAC and it was a rat study, it wasn't a human study, but it looked like
yeah,
take NAC along at the same time, not in the aftermath, actually protected the kidneys from being damaged. So if you're on lithium, it might be really good finding a practitioner that knows about this and looking at going on NAC if you can't come off lithium because it's the thing that's controlling bipolar or whatever it is for you and it's really effective. Maybe you add some NAC in at the same time and you use them together, and that will offset some of the kidney damage. And then working with someone like Jess to optimize kidney function, I don't think is a bad thing. I think that's something that we should do if we're going to go on medications like the statins or lithium that we know have, what did I say? 57 to 75% of people that go into lithium will end up with the
diabetes insipidus, nephrogenic
yeah,
diabetes insipidus. That's a lot. Yeah,
that's high. So why wouldn't you going forward and knowing that okay, you may not, mood disorder may not cure, but kidney disease might, and then all the side effects of that. Why would you not co-treat it the whole way and maximize and optimize your kidney function throughout your whole treatment? I think that makes common sense, right? So I think having some NAC on board and optimizing kidney function from staying alkaline and all those great things is only a good thing to do.
yeah, I think so too. Yeah, and again, like foundations, right? Like you said, right? Get your foundations, then start working up the ladder. That's the best healing that you can do, and those are effects that last a long time too. So,
Exactly. Is there anything else that we've missed or you want to add about lithium toxicity and kidney disease?
I don't think so. I mean, I think the big takeaways are if you're on lithium, don't just like cold turkey stop it. Like you should still talk to your like
Mhm.
to your psychiatrist or whoever has prescribed it to you. Please,
Yeah.
please don't like cold turkey for mental health and for medications that have been put into place for you know any sort of mental health issue, schizophrenia, bipolar, whatever. Don't stop those cold turkey. You should absolutely work with your doctor if you're going to want to come off of those. It's so
100%.
so so important. You can have such massive like events that are not positive.
Yeah.
But talk with them if you're worried about it. Can I, like, what would it look like to titrate this down? Are there any other options? Here's where I'm at with my kidney function. Those are things that absolutely you want to have discussions about. And then when you work on this, then, maybe get some functional testing from a good qualified clinician, build your foundations, alkalinity, right amount of protein, enough micronutrients, and then from there you can start working to remove it
Yeah.
slowly.
Yeah.
Slowly. That
Totally
would be
agree.
my thing, right? Slowly.
Yes. Slow and steady wins the race. You want to be the tortoise, not the hare in this one.
In this one, you want to be the tortoise. I would say that slow means you go fast.
Yeah.
And if you go fast, it could really come back and hurt you.
Yeah.
So
No, I totally agree. All right. Well, if anyone wants to reach out to Jess to detox or work with their kidneys or just general kidney health in general, I will put the website there, but it's Kidney Nutritional Organization. But no, it's kni.org, right?
kidneynutritioninstitute.org.
.org.
Sorry, on kidneynutritioninstitute.org. If you type in, like in Google, KNI, Kidney
It comes
Nutrition
up.
Institute, it'll pop up. We're on
And I'll
Google.
put the link in below. So I always just shorten it because I'm an Australian and we shorten everything. So I will drop the link in below. Jess has got an amazing team of practitioners there that she works with that are all very highly qualified and all think the way that we do at Kidney Coach outside the box and really the new right in front of the research and staying upstream with that sort of stuff. I think that's really important.
Yeah.
Jess, thank you as always for joining me. If you want to know more about what we do, make sure you head to kidneycoach.com. You'll find us on Facebook and Instagram. Make sure you hit subscribe and like. That way you'll get notified anytime we put up new content. And if there's any topics that you want Jess and I to tackle, put them in the comment below and we will add them to the list of things to talk about. Jess, pleasure as always. Thank you. Thank you.
Yep. All right. Thank you so much.